Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. I am your host, Karen Litzy, and today's episode is brought to you by the lovely folks at Net Health. Net Health has created the Redoc Patient Portal, which provides a secure line of communication between you and your patients. You can conduct video conferencing for telehealth. You can have secure messaging between you and your patients. You can share documents and photos, and your patients can have 24/7 secure on-demand access to their therapy health information without phone calls and voice messages. If you want to learn more about the Redoc Patient Portal, then contact Net Health at Redoc, that's REDOC, at nethealth.com. Now, on to today's episode. So, as a lot of you know, I do a lot around pelvic health and pregnancy, and today is one of those really wonderful episodes, and I am so happy to welcome Dr. Helene Darmanin. She is an orthopedic and pelvic health physical therapist with over a decade of experience facilitating healthy, empowering movement for her clients as a physical therapist and a fitness and Pilates instructor. Inspired by her own motherhood and ardent feminism, she specializes in preparing and healing pregnant and postpartum mamas. So yes, that is what we are talking about today. So today, we do talk about Helene's experience with her pregnancy journey. And I'm very, very thankful that she shared that because I think her experience will hopefully help others. Body positivity during pregnancy and the postpartum period and how it can optimize outcomes. We talk about what the mom bod is, the American College of Obstetrics and Gynecology guidelines for exercise while pregnant, and reasons to go to a physical therapist when you're pregnant, and reasons to go to a physical therapist in the postpartum or the quote-unquote fourth trimester period. So, a huge thanks to Helene for sharing her experience and giving us all this great information on how to stay healthy during and after your pregnancy. Hey, Helene, welcome to the podcast. I am thrilled to have you on. Welcome.
Thanks so much, Karen. I'm so grateful to be here.
And so today we're going to be talking about pelvic health or women's health after pregnancy, during pregnancy, which, you know, longtime listeners of the show will know that I've had a lot of episodes on this, but I'm particularly excited about this one, Helene, because you're going to, I think, bravely share a little bit about your story, about your birthing experience and your experience with your body and how it changes and continues to change even after. So I'm just going to throw it to you and just kind of let you tell your side of the story.
Thanks. Yeah, I know that my son is about to be 1 on Monday in just 6 days. So I know that in my time since I gave birth or while I was pregnant, hearing other women's stories always helped me to not feel alone, even though I knew what to expect because I specialized in pregnancy and postpartum long before I got pregnant. So I'm really excited to share some of my story. The biggest thing that happened when we first started trying to get pregnant was we were trying to conceive and we got that positive pregnancy test. We were so excited, but then. And I remember because it was Thanksgiving and all my family was so excited because we shared right away because I figured no matter what happened, I wanted to have the support of my loved ones. A few days after Thanksgiving, I started to have some bleeding and I started to have some cramping. And it was before I had even gone for my first prenatal visit with my OB. And when I showed up for my first prenatal visit, she said, "Congratulations." And I said, "I'm pretty sure I'm having a miscarriage right now." And sure enough, I did miscarry at about 7 weeks, which is early enough that some people don't even call it a miscarriage. It can be called a chemical pregnancy. My OB was incredible. And she said to me, they say when it's this early that you should be comforted because it was probably a chromosomal abnormality and, it just naturally aborted itself. She said, but that didn't help me when I had 2 miscarriages. So I feel you. And that meant the world to me. Because it was a hard thing because we wanted the pregnancy so badly. And then actually I had a lot of trouble with continuing to bleed. And then I ended up needing an emergency D&C because I had a blood clot that was actually blocking the full shedding of the uterus. So that was, in the midst of all the sadness, it was also scary and confusing. But I was really fortunate. I had some great practitioners and made it through okay. And then actually we were really lucky because we were able to conceive then the first month that we were allowed to start trying again, which was, I had to get my normal period back, which took about 6 weeks. And then we were able to start trying again. So I feel really fortunate that we were able to do that. And that time I texted my OB right away. I actually used progesterone suppositories, which are really uncomfortable. They're like frozen popsicles of progesterone that you have to insert vaginally every night. There's really mixed evidence about them. There's nothing very conclusive, but my OB was like, it'll make you feel like you're doing something. At bare minimum, you'll get that great placebo effect.
And what is the reasoning around using that?
So there's some thought that the fetus won't implant if the progesterone levels are too low. So you're causing a local increase in progesterone to help facilitate the fetus implanting.
Got it. Okay. So sadly, you had a miscarriage, which, for a lot of people listening to this now, if you follow social media, we were talking about this before, Chrissy Teigen and John Legend were very, very open about their miscarriage, which happened, I don't know how many months along she was, but enough. And that the comments were, oh my gosh, I'm so glad you're talking about this. No one talks about this. Women are so ashamed of it. Couples can be ashamed of it. Did you go through any of those feelings, or was it like, okay, this happened, full steam ahead, let's keep trying? You know what I mean? I think you've got like both ends of the spectrum.
Yeah. I think I was somewhere middle of the road. I think I feel very fortunate that with my awesome support network and my great care that I had from my OB and my acupuncturist too, who I saw, who helped me recover, that I didn't feel guilty. I didn't feel like I've heard people talk about feeling like their bodies had failed. But I did feel a lot of sadness. I didn't necessarily share right away, except for with my very close circle. But I've certainly never kept it a secret. I've never felt like it was a shameful secret. And I've always wanted to share it in case it does help someone else who has that experience. Because as it turns out, the more I talked about it, the more women who I talked to said, oh yeah, that happened to me. Oh, that happened to me. Yeah. In fact, a lot of my friends were like, I feel like over 30, the first one is like a trial run. And like, you kind of, a lot of women, their first pregnancy was like that chemical pregnancy or miscarriage.
Yeah. So all of a sudden you're not quite so alone.
Yes.
Oh my goodness.
Makes a big difference.
Yeah. So now let's talk. So you get pregnant. So let's talk about your pregnancy, the birth, postpartum, because all of this part of your story, we're going to be tying into things that the listeners can do if they're in any of those phases. So
yep, absolutely. So I was really lucky during the first trimester. I didn't have too much morning sickness, some slight nausea that usually eating a croissant helped. Unfortunately, it was always a croissant.
Well, lucky you.
Yeah. And, but I was exhausted 100% of the time my first trimester. Like, I have always been super energetic. I've been a fitness instructor, like, for my whole adult life. And I just wanted to sleep where I was standing all the time. So exercising was really difficult, which was hard for me because it's such a part of my life. And I would like put on an episode of Outlander and get on a stationary bike and be like, as long as your legs are moving, it counts, it's exercise, with like no resistance on the bike. And I would get to my 30 minutes and count it as a win. So that was the first trimester. Second trimester was pretty awesome. That's kind of where it's at, because you're starting to show, which is fun. And then, and energy levels come back up, but you're not like a whale yet, which is great. But by the end of the second trimester, when I was starting to get kind of big, then I started to have very typical pregnancy symptoms of back pain. Interestingly, my back pain was the worst kind of at that transition between the second and third trimesters. And then by the end of the third trimester, it kind of disappeared. My body kind of figured out how to be that size, I felt like. I also had extreme swelling in my hands and feet. So I was wearing compression socks, wearing wrist splints at night. I was having a lot of wrist pain because I was actively working as a physical therapist on my feet and manually treating patients. So that was hard to handle. I tried a cortisone shot, actually. I tried PT, of course, and then I tried a cortisone shot, and none of that really helped. I had pretty bad carpal tunnel until I gave birth. And it was just like my hands and feet looked like little sausages, which was really, really pretty funny. And by the end of the third trimester, I was, again, really tired, but I managed to work until I was 38 and a half weeks pregnant. On my feet, demonstrating exercises, even though I gained well over the recommended amount, and I gained 47 pounds, which interestingly was exactly what my mother gained with both her pregnancies.
Weird. And so what is the recommended? Isn't it like 25 to 35 or something?
25 to 35 is the midline, though the most recent American College of Obstetrics and Gynecology recommendation is anywhere from 11 to 40. So there's a little more acknowledgement that now there's a broader range that can be considered normal.
Got it.
Quote unquote.
Okay, great. And so I think it's also good to note that what you were feeling, back pain, swelling, these are all, like you said, these are pretty typical, right? It's not outside the realm of normal to have these symptoms when you're pregnant.
Right.
Okay, so then you go in, you give birth.
Yep. So I had one day of false labor, which was very frustrating. I wanted that kid out by 39 weeks. I was like, nope, done, out. And then a week later, I went into real labor. I had a doula. I was just ready to have my vaginal unmedicated birth. It's what I always wanted. I got to the hospital, and luckily I was 6 centimeters dilated, which is when they consider active labor is starting. So they were able to keep me at the hospital. But oh my goodness, was I tired. I started having contractions on a Friday late morning, went into the hospital by about 3 a.m. Saturday morning. I had gotten maybe 3 hours of sleep. My doulas recommended that I sleep more, and of course that's what I recommend to all my clients. And I was like, no, I don't need to sleep. I'm going to keep walking because that'll help my labor progress. So I walked around my block 1 million times. And so by the time I got to the hospital, I was so tired. That's mostly what I remember, is just being exhausted. And I advise on changing positions during labor and how to best facilitate things. And my doula was like, let's get on hands and knees. And I was like, nope, not moving. I am not moving. And then actually did have some complications during labor where my son had a cord wrapped around his shoulder. So every time I would push, the cord would become compressed and his heart rate would drop. But it wasn't my OB. I went in just after she got off call that night at midnight, and I got into the hospital at 3 a.m. But the OB who delivered me was fantastic. She was really, really fantastic, and knew that I was really committed to having an unmedicated vaginal birth. So there was never a moment where she was considering anything else. She just kept me charging. And I ended up giving birth in exactly the position I didn't want to, which is lithotomy position. So on my back with my knees spread and doing directed Valsalva breathing, which I also didn't want to do because both of those things increase the likelihood of vaginal tearing. But it was the only way that we were going to get that kid safely out with his heart rate dropping. And we did. And she was able to cut his cord before he was fully out. And we're able to get him delivered vaginally, unmedicated, and safely. So that was quite an experience. And it was really funny, actually. My husband was like, yeah, like that's how you do it. You unmedicated, and he was like, where are all these sissies who need epidurals? And my doula was like, no.
No,
you don't understand. 90% of women in New York City get epidurals. Like, your wife is nuts. So I was like, yeah, you don't get to judge. That's not an experience you'll ever have.
Exactly.
Yeah, so it was a roller coaster, and then I still didn't sleep because I was so excited about having my son, and so that was really like a crazy up and down day then that Saturday when he was born that morning.
Yeah, I mean, wow, that's dramatic. That's a lot of drama for one birth. But it's also, I mean, I can imagine the relief of having him born safely, and there you are, you're in the hospital, you take your baby home, you know, you've been teaching other women on how to work with their postpartum bodies for a long time. But now let's talk about, you get home and, you know, a couple of weeks go by and you have we all talk about the dad bod, but you know, there's like, you have like the mummy tummy or the mom bod. So what advice do you have for people to kind of stay body positive during this whole period, whether it be during the pregnancy, postpartum, and what being body positive can do for you?
Yeah. So I've always been an advocate of body positivity, and this was a time in my life where I felt like it really paid off. In general, I think that body positivity creates this cycle of self-care where if you take care of yourself, then you feel good about yourself. And if you feel good about yourself, then you're more likely to take good care of yourself. And it becomes a very positive spiral. So I've often used that with my clients. And it was definitely my turn to use it for myself. I was a ballet dancer, so I definitely have had an awareness of body image for most of my life. When I was pregnant, I felt like when I was pregnant, it wasn't as hard to have positive body image because everyone's just telling you how beautiful you are and you're glowing and it's so exciting and the thrill. So you get a lot of positive reinforcement from outside, but I feel like a lot of that ends after you give birth. In fact, we were just talking about the New York Times, in her words newsletter today, was a mom who was talking about her experiences postpartum and saying that a lot of times, even if you had a complicated birth or you were in a lot of pain, people say, oh, well, at least the baby's healthy. And they completely brush aside the mother and her experience and her symptoms. And I'm very much of the thought that, yes, it's wonderful the baby's safe and healthy, but in order to be a good parent and effective caregiver, you need to put on your own oxygen mask first. So starting to take good care of yourself and feeling good about yourself is going to make you a better parent, in my opinion. Plus, it's just, regardless of your status as a parent, it's important for especially women, because we're often ignored in this regard, to feel good about ourselves. So in terms of staying body positive, after I gave birth, I actually, strangely, I found it very helpful to spend some time like with my body and kind of noticing the changes. So I took a little longer in the shower, where I would kind of be grateful to different parts of my body while I was showering. Like, wow, thanks to my stomach that was able to stretch and hold my son. Like, thank you to my breasts that are able to produce breast milk and nourish my son. We did have a lot of struggles with breastfeeding, so I was very grateful when we got it down pat. And, you know, I got rid of a lot of clothing because anything that was squeezing me or making me feel uncomfortable, you know, instead of trying to squeeze back into my old clothes where every time I would shift or move, I would feel like the pinching of my old jeans or, you know, like the bra cutting into my sides. I got rid of all of that. unless I really thought it was realistic, then in which case I put it aside and I didn't even look at it. I lived in leggings and nursing tops for at least 3 months because it was comfortable. So I wasn't constantly reminded that I was a different shape, that I wasn't, it wasn't my old body. And then I started moving pretty early in my recovery. I was discharged with the hospital with the very old school instructions of, wait 6 to 8 weeks before you start exercising.
Mm-hmm.
And at about 3 weeks, I was losing my mind. And I was like, hey, wait a minute. I can give medical advice too. And I can exercise under my own medical supervision. So I started exercising. I started really gently. But there's at least one study, I believe there are a couple studies that have shown that even one bout of exercise improves your body image.
Mm-hmm.
So getting moving and feeling like I was in control of my body and really starting to feel what it was capable of for myself, not just feeling what it was capable of in terms of giving birth to a human, which was also incredible, but starting to again feel like, oh, look, I can lift this weight, I can do this movement. And all the positive feelings that come from exercise definitely also helped.
Yeah. And kind of, again, taking agency over your body. And I really love giving yourself a little extra love in the shower. I think that's great advice for anyone. If you gave birth or not, sometimes just getting older, things change. Yep. Or, and being able to acknowledge that things change and that's okay. And you're still, in love with everything that you have. I love that. That's great advice. So now you talked about exercising. You sort of went back about 3 weeks after, but let's talk about exercising while pregnant. So the American College of Obstetrics and Gynecology, they put out guidelines on exercise. So do you want to kind of fill us in on maybe what those guidelines are so that if there are women out there listening that are pregnant at the moment, they can have a better idea of what they can and can't do?
Absolutely. I'm really excited about them actually because there are new ones this year that are much more forward thinking in their recommendations. So there has been a lot of fear mongering about exercising while you're pregnant in the past. And this year, the recommendations are that virtually everyone can exercise while they're pregnant, whether you exercise before you were pregnant or not. They do recommend that everyone obtain medical clearance first with a thorough exam to talk about any possible medical complications that could arise from exercising. But there used to be the wisdom used to be that if you didn't exercise before, you couldn't start while you were pregnant, and they have completely changed that. And they've even to the point where if you are an athlete or someone who regularly exercises at high intensity, they say that you can continue to do that through the third trimester safely. And they recommend exercise because it actually decreases the incidence of diabetes, of gestational diabetes, and other blood pressure complications while pregnant, like preeclampsia. It decreases the likelihood of giving birth preterm, and decreases actually the incidence of low birth weight, interestingly. And it also decreases recovery time postpartum. So it improves postpartum outcomes, kind of sets you up for success, especially during that time where you might not have time or might not be able to exercise yet right after giving birth. And it actually increases the likelihood of having a vaginal birth. So if that's something you desire, exercise can help you get there. And it decreases the likelihood of postpartum depressive disorders. So those endorphins that you get while you're exercising kind of carry through to the postpartum period.
Wow. Well, that's a lot of positives for exercising while pregnant. Are there any sort of big no-nos?
And on that note, we're going to take a quick break to hear from our sponsor and be right back.
This episode is brought to you by Net Health, helping you maintain strong relationships with your patients. The ReDoc Patient Portal provides a secure line of communication between you and your patients. Conduct virtual visits and have follow-up conversations with your patients via secure messaging when it's convenient for you. Patients have 24/7 secure, on-demand access to their therapy health information without phone calls and voice messages. Video conferencing for telehealth, secure messaging, share documents and photos, and view health information and appointments. To learn more, contact them at redoc@nethealth.com.
A lot of it's on an individual basis, and getting assessed by a PT who specializes is a great idea to see if you're able to still engage your transversus abdominis and see what positions might be best for you. They do continue to recommend that you don't stay supine on your back for longer than 2 to 3 minutes past 20 weeks of pregnancy, because you can become hypotensive because of the weight of the fetus on your blood supply. And they also recommend that they also really emphasize staying well hydrated. And if you're doing anything vigorous for more than 45 minutes, to really make sure you have adequate calorie intake before, maybe during and after, to avoid hypoglycemia, which is not uncommon in pregnancy. With my clients, I still recommend avoiding isometric exercises. So planks are awesome, just make them dynamic somehow. To help the body regulate the blood pressure, because there's just a lot of demand if you're holding a position and you're holding that tone in the muscles and you're trying to support a fetus. It helps a little bit to keep those muscle pumps helping the blood pressure regulate. Besides that, it's on a very individual basis. It's what you're familiar with. It's how your pregnancy's been progressing. So it's really a good idea to talk to somebody.
Okay, and speaking about talking to somebody, everybody who listens knows I'm a physical therapist. You're a physical therapist. So let's talk about reasons why women should go to a physical therapist when they're pregnant. I mean, it doesn't mean you have to go every week of your entire pregnancy. No, but let's talk about why every woman should be seeing a physical therapist when they are pregnant.
Yes.
Period.
I love that. Yes, they should. So in the same guidelines this year, ACOG says that back pain has an incidence of about 60% in pregnancy, but that's extremely underreported because most women just consider it a normal part of being pregnant. So I think back pain in pregnancy is pretty much universal. So that's one great reason to go to PT, because it can help alleviate that back pain. And I did see a physical therapist myself when I was pregnant to help with the back pain. Also, if you're having experiencing things like sciatica, wrist pain, which I had one kind of wrist pain while I was pregnant and a different kind of wrist pain after I gave birth, partly just because of the increase in fluid in the body, but then also changing joint mechanics because your ligaments are looser. If you have pelvic pain or pubic symphysis dysfunction, which you would know because your doctor would tell you, or you'd have a lot of pain in the front of your pelvis, or even sprained ankles have a higher incidence in women who are pregnant because, again, of those joint changes. But also, if you are having the perfect pregnancy, which would be amazing, and you have no pain whatsoever, you're that miracle person, you can still help prepare for giving birth. There are PTs who specialize in helping with things like breathing techniques, preparing your pelvic floor muscles. And it might be a simple consultation 1 time, 2 times to get some advice on what you can do to help yourself prepare. And also, if you have any history of injuries or any current pain, then also PTs can help advise on what positions might be good for you, and they can help coordinate with your OB or your midwife, whoever your birthing professional is.
Absolutely. And now, all great reasons. Now let's talk about after you give birth, the 4th trimester, right? So ACOG came out with these guidelines about the 4th trimester. So first, can you tell us what the 4th trimester is for those who are not aware? And then what is the physical therapist's role in the postpartum period?
Absolutely. So 4th trimester, kind of a tongue-in-cheek way of describing the 3 months after giving birth, because the idea is that your body is still changing and your baby is also still changing a lot. There's some thought that when we were primates, our babies would have gestated for longer and come out further along, but our heads became too large, and that's why babies started to be born earlier and earlier. So that's part of the reason that human babies are so vulnerable when they're born, as opposed to other species like, giraffes who like pop out and run away from their mothers. And meanwhile, our kids can't see, or
they're like little blobs on their backs.
They really are. They're adorable blobs, but they can't do anything.
Right.
And one thing I hear a lot about the fourth trimester is women trying to get their bodies back, which I think
I need to bounce back quickly, right?
Which I think is just so depressing, because you're not going back. Why would we ever want to go backwards? You're going forwards in your life, so why not take your body forwards with you?
I love that.
And you know what? I will say, just personally, like I gained, like I said, 47 pounds while I was pregnant. I have since lost all 47 pounds. I am still breastfeeding though, so we'll see what happens, but I am shaped totally differently than I was. And it's not a good thing or a bad thing, at least to me. Like, it's just different. My body is totally different now. And that's okay. I'm really excited about what it can do. I love being a mom. So that's really important. But anyway, in physical therapy, in the world of physical therapy, so again, it's a lot of similar reasons, usually back pain, but that can be, again, it can be from how you gave birth. It can be from, especially if you're still breastfeeding, you still have a lot of those quote unquote pregnancy hormones that cause the ligaments to be a little bit more flexible. Plus, if you're breastfeeding, the way that you're holding your child. Also, if you even just picking the kid up and down and getting on and off the floor and changing diapers, which can, like, by the time they can turn over, sometimes it's like a circus. That can cause back pain, wrist pain. And then of course you have your pelvic recovery, which for the first week, I don't think I was thinking about myself very much, but every once in a while I would realize that I felt like my vagina was on fire, and sitting was horrible. It was the worst thing ever. I remember we were taking my son to his first pediatrician visit, and I was sitting in the car like sideways on one butt cheek to try to avoid putting my perineal area on the seat because it was so uncomfortable. So that's normal for the first week, unfortunately. Even if you've had a cesarean birth, that can you still have that huge change in your pelvis after it no longer has this weight on it, and you have all these hormones released. So it could still be very uncomfortable and tender in your perineal area. But yeah, that brings me to another point. Scars are a big thing that should be treated. You would treat a scar from any other surgery or massive injury. So I don't know why it's not routine to refer for scar therapy after, if you've had any vaginal tearing with giving birth, or if you've had a cesarean birth. Those scars can really cause a change in function. They're not as elastic as the tissue around them, and that excessive tissue that's there can disrupt the function and cause a lot of discomfort. So I had grade 2 vaginal tearing because of my birth experience, and I saw a PT myself to have my scar tissue manually worked on, and work on some release techniques from my pelvic floor, which was super tense because it was trying to hold everything together during that loosey-goosey postpartum phase. That also, for me, I had pain with penetrative sex after, you go to the OB and they're like, oh, yep, healed, done. 6 weeks. Go back to doing whatever you want. And I was terrified of resuming sexual intercourse, and I'm very grateful for my PT who helped me figure out how to comfortably and safely get back to having sex.
Yeah. And all these things, like you said, like so many women are experiencing these things. Yeah. And I think it's so important to just vocalize that and put that out into the universe so that women could be like, oh, wait a second. Oh, I can go to a PT and they can help with that. Or I can go to a PT and they can help with incontinence afterwards. Or they can help, like you said, have sex with my husband or my partner afterwards. I mean, wow, this is revolutionary for a lot of women, to know that this resource exists. And you just have to find that physical therapist, preferably one who is trained in pelvic health and who understands the pelvis in a more intimate way. And that doesn't necessarily mean that your therapist has to be a woman. There are also men who specialize in pelvic health as well. So I want to give a shout out to all of our colleagues doing that around the country as well. And oh, go ahead.
Sorry, I was just going to say, also there are PTs who have been trained in helping support breastfeeding in terms of what positions to use, treating clogged ducts, or even just education on, effective techniques. There's also pelvic organ prolapse and incontinence, as you mentioned, which can happen regardless of if you've had a child or not. And that can also be treated with physical therapy. Again, some incontinence after giving birth is actually normal for up to a month or two. But if you're still leaking after that, then you should definitely seek help. And again, even like you said with pregnancy, like why every pregnant woman should get PT, everyone should get some advice, professional advice on how to safely return to movement, whatever movement you want to do, whether it's, a yoga class or a couple group fitness classes or going back to playing a sport. And that's something we specialize in, is movement.
And in many countries, it's everyone goes to
standard
see a
of
PT.
care. Yes.
It's the standard of care, and hopefully now that these are part of the guidelines by ACOG, that is something that will become a standard of care. I interviewed Dr. Camila Phillips, who is an OBGYN at Lenox Hill, and she recommends all of her patients to see a PT. Yes. And I love it. And that was awesome.
Brilliant.
But I don't know. She might be in the minority. I'm not sure.
I think she is.
But
that's been my experience.
Yeah. But I just love that she is so forward thinking, and for women to know that you have all of these resources. It's so empowering to kind of help you help you move forward. I love that. I almost said get back to.
Well, get back to doing what you like to do.
Yeah, exactly. Get back to doing what you like to do. And whether that be any kind of movement or running or high intensity sports, just because you have a child doesn't mean that you can't return to the things you were doing before. And I think that's where the PT comes in.
Absolutely. And with the help of my PT and like my own expertise, at like 5 months, I was back to boxing and high intensity interval training. And I will tell you though, the first time I tried to do a jump after giving birth, I mean, I don't remember how long postpartum I was, maybe 3 or 4 months. I was like, oh my God, I am an elephant. Like I just felt like I had no pep, no spring whatsoever. I felt like every time I landed, I was like, thud. It took a good few months for me to feel like I had my spring back, my like pep in my step.
Yeah. And again, I think this is all great for people to hear. Like I think women don't give birth and then, go back to like walking the Victoria's Secret runway show, like Heidi Klum, like that's not normal.
No.
Do that like 4 weeks after you give birth. No, not normal. Not. Like that is an exceptional human being there who has very good genetics, I'm assuming. And also it's her job.
Yes. And a lot of expensive support, I would assume.
Yes. And a lot of expensive support that us average Joes just do not have.
Nope.
Don't have it. All right. So Helene, what would you like to leave the listeners with? If you could leave them with, your top tip or your takeaways from this, from our discussion here.
That's a tough one because there's so many good tidbits in there. I think my top tip is just to love where you are. I mean, love your body where it is. Love it for what it's done. Love it for what it can do right now. And get some help if you need help loving it. If you need help, getting it to do what you want it to do, there's so much help available. It's just a matter of finding it, which shouldn't be as difficult as it is, but it is there.
Yeah, fabulous. And now, last question that I ask everyone. Given where you are now in your life and in your career, what advice would you give yourself as a new grad, fresh out of physical therapy school?
Well, I would say trust your intuition. My program was very into evidence-based physical therapy, which is awesome, and everything should be grounded in evidence, but never forget that clinical expertise and clinical experience is also a level of evidence.
Excellent. And I've heard that many times from people on this show.
I'm sure you have.
So,
I've heard it on your show too.
Yeah, many times. Well, now where can people find you? Where can people get in touch with you if they have questions or they want to know what you're up to?
Great question. I'm on Instagram at HeleneB_PT. That's the best place to find me. I'm currently practicing at Danford Works. So you can find me there, or I would love to hear from anybody via email. It's hdthept@gmail.com.
Perfect. And we will have all of those links in the show notes for this episode at podcast.healthywealthysmart.com. So if you didn't have a pen on you, you didn't write it all down, don't worry. One click will take you to everything Helene. And I will say she also, on her Instagram account, really great exercises, advice, and support. So if you're looking for that, then definitely follow her on Instagram, because you give a lot of great exercise and support, especially for women throughout and after pregnancy. So definitely give her a follow on Instagram. So Helene, thank you so much for coming on. This was wonderful. And thank you for sharing your story, because I know it's not easy.
Thanks, Karen.
And everyone else, thanks so much for listening. Have a great couple of days and stay healthy, wealthy, and smart.
Hey, everybody. A huge thanks to Helene for really going deep with us there and sharing her experience during her pregnancy. So thank you, Helene, for sharing all of that. And of course, thank you to our sponsor, Net Health. So Net Health has created the Redoc Patient Portal, which provides a secure line of communication between you and your patients. Conduct virtual visits and have follow-up conversations with your patients via secure messaging when it's convenient for you. Patients have 24/7 secure on-demand access to their therapy health information without phone calls and voice messages. To learn more, contact Net Health at Redoc, that's REDOC, at nethealth.com.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.